When the team in scrubs enters the cardiosurgery suite at the Queen's Medical Center, innovation comes along. It's not just in the cutting-edge equipment here. Queen's has invested in a person, psychologist Andrea Hermosura, who is making the team better by
standing off in a corner, trying to be invisible, and just watching specific behaviors.
Behaviors that could unintentionally blindside the best intentions.
It's very hierarchical in the OR, and the surgeon is the captain of the ship. And traditionally, no one corrects the surgeon, not even other physicians.
Some people will say, why didn't you say something? And they'll say they may not feel comfortable either because they're a woman and it's a man, or I'm Japanese and there's somebody else who may be speaking loudly and we're not used to speaking loudly.
It's difficult when you're at this level to sometimes to speak to that higher level, the surgeons, the anesthesiologists.
As the Queen's Health Equity Scholar in the medical school's Department of Native Hawaiian Health, Andrea has helped the surgical team understand and overcome unspoken barriers right here where it counts most.
And I think the nice thing about doing it in the operating room is that they get immediate feedback about behaviors that they're engaging in during an operation, rather than 3 months later they get a report of the things that I've witnessed and things that I think should be worked on.
What she's been able to bring to us has changed our practice, has really changed how we interact with one another.
We identified a gap in our efforts to improve patient safety, to improve quality of care, and we now have the perfect person who can fill that gap for us and work together as a team.
I really am very grateful to the board and the hospital for having that kind of position.
The Queen's Health Equity Scholarship is a great example of how the University of Hawaii and academics can relate to Queen's Medical Center and clinical care.
Andrea's impact will be written up in a journal because this kind of collaboration has never been done before.
It places us here in Hawaii in a unique place to be the leaders in research in this area and the leaders in providing care.
It's better. It's much better. It's much better.
Queen's also has invested in young doctors like Tui Lauilefue, an internist at the Queen Emma Clinic, which sees up to 32,000 patient visits a year.
It takes a unique and special person to be able to be here at Queen Emma Clinics. You know, our patients are those who are challenging, and not because of their own fault. They are here because of circumstances, sometimes beyond their control. And when they have nothing and they have no one to care for them, we're here at Queen Emma Clinics to help them and care for them.
We have people who are homeless, so keeping that in mind, you in your head can have one thought like, oh, you definitely, please stop eating from the dollar menu. Why are you eating so many fries? You're drinking soda, your salt is too high. But you have to understand to the patient that may not be the priority for them. Taking the medications, watching what they eat, they're just kind of limited to what's there for them. It's very different priorities, and that's just an example. So whenever you're seeing a patient, just kind of keeping those things in mind and when addressing their plan of care. And it's not just a one-way street, so you're giving recommendations, but at the same time, you want to make sure that the patient is also invested in their own health care. So educating them and then letting them know that it is a partnership between you and the provider. So I'm here to help you, but you also have to be willing to put in yourself so we can work together in order to improve your health care.
Tui embraces patients here at Queen's.
Well, thanks for coming in. We'll see you next time.
Just as Queen's embraced her when she was struggling to get into medical school. The intensive Imi Ho'ola Post-Baccalaureate Program has schooled 256 physicians, including Tui, but it is no easy way in.
It was a difficult time. And we couldn't really afford to lose focus at that time because you're so close to getting into medical schools.
The Queen's Health System kept Tui and other Imi afloat with a monthly stipend, a far-sighted investment that is creating a perpetual next generation of healers who are also health leaders.
We need special, people, attendings, physicians like, Dr. Tui, to be able to care for them and at the same time also train those, future physicians to serve our community.
I'm glad that, this has then provided me the opportunity to now give back. And now I'm on the other side of things. And again, to Queens, I truly am grateful for that opportunity.
I'm super, super grateful for your opportunity. Mahalo nui loa.
Thank you for believing in us, and thank you for investing in our future.